Okay, I think we can start now. So, hello, dear friends and colleagues. And very warm welcome to the third SHE webinar. And my name is Marja-Riitta Sormunen, and this broadcast is coming from the University of Eastern Finland. The theme for this webinar is School Health Promotion for Vulnerable Children and Adolescents, and we have two excellent presenters who both are members of the SHE Research Group. Assistant Professor Rafaela Rosario from University of Minho introduces us a school-based intervention program for children with vulnerabilities, after which postdoctoral researcher Outi Savolainen from University of Eastern Finland shows us key findings of 3 studies representing children's mental health promotion in school context. Warmly welcome both of you. And then I have a pleasure to facilitate this event with my dear colleague, Professor Kevin Daraczynski. And before I give Kevin a floor to Mentimeter activity and to introduce our first speaker, I inform you that this webinar will be recorded and will be available afterwards in the SHE website. Also, we ask that all the questions and comments to the webinar presenters would be written in the Zoom chat. We will come back to them after each presentation. Okay, now Kevin, please.
Thank you so much, Marja-Riitta. A warm welcome to all who attend this third webinar on vulnerable school children or adolescents and children. So happy to see you all. Would be great if you could turn on your camera just to see you, would be so great. Before we start with the webinar, we asked you to answer 3 questions, and I would like to provide you with the results of the answers you gave. I just share my screen and hope that you can see it right now. So we asked you 3 questions, and the first question was, what kind of vulnerabilities do you think are most relevant for children and adolescents? And you know, this kind of way you visualize the results, the bigger the word is, the more often you have named it. So what you can see here quite in the middle is the term social. So you see social vulnerabilities, which is very much associated with, for example, low socioeconomic status that you can see on the right side of the screen, or also social inequalities. This has been named very often here, and it's still in progress, as you can see here. You also named inequalities, so every form of inequality. You also mentioned mental, the word mental. It could be everything, could be mental conditions for the children and adolescents themselves, but also for maybe families or other relatives. Sexual identity has been named, health issues in general, but also other forms of mental problems like trauma. Let me have a look. It's a little bit difficult to see, but you can see lack of health literacy has been named as well. Access to health informant, refugee status, of course, one of these vulnerabilities has been named as well. So it's very important, we thought, to frame a little bit or to think a little bit about the term vulnerabilities, as we tend to use this term quite often without naming it, what we mean using this term. So thank you for this. Let's move on to the second question. We asked you, does your country has a health promotion strategies that specifically targets children and adolescents at risk? And you said, with about 1/3 of you said, don't know. You don't know if there's any policy in place. Another third said, yes, this is integrated in a broader policy. It could be any policy on health, on social issues. And about 22% said, yes, there is an own policy addressing children and adolescents at risk. So this would be very important when we talk about this issue. If you have an issue in your country, have a policy in your country, or if you're in need of a policy in your country. So let's move on to the last question. We ask you, what do you think are the best strategies to address vulnerable young people in the school? And the same here, health promotion is quite in the middle. Of course, it's a strategy that is one of the most promising strategy, as it addresses not only individual level determinants of health, but also the wider determinants of health. So of course, this is something that we all seem to share. You also mentioned co-creation process, involve the family, but also whole community. So to link the children with the community around, that seems to be very important and has been mentioned several times. Also teachers, community and school, all those kind of links has been mentioned several times. You also mentioned school development, something that is beyond the individual level, but also the whole school approach that reflects wider thinking that goes beyond individual level determinants. So this seems to be important points here when we talk about vulnerability in children and adolescents. So thank you so much for attending this short Mentimeter. I will now stop my my presentation here and would like now go over to the first presenter. And I'm really delighted to hand over to Professor Rafaela Rosario from University of Minho from Portugal, my dear colleague and friend. So great to see you here. Rafaela is an assistant professor. I already said it, from the University of Minho and from the Research Center in Nursing. You're also a researcher at the Health Science Research Unit, and you have significant experience in running and leading community interventions and observational studies. You're currently leading a cluster randomized trial in schools, co-developing an intervention program with children and stakeholders to prevent obesity and non-communicable diseases among schools from vulnerable conditions. You're authored so many papers and other journal papers and book chapters, etc. So it's worth to look at this. And you're also a member of several research networks, not only the SHE network, but also other networks. So great expertise that we have here with you. Thank you so much. You will talk about health promotion and community engagement, confluences and trends of a school-based intervention program for children with vulnerabilities. So great to have you. I would like to give you the floor.
Thank you, Kevin, for this nice presentation, and greetings to all. It is with great pleasure that I am in here emphasizing a research project that we are currently implementing. I would like to thank you, Kevin and Margarita, for inviting me here. Throughout this presentation, I will address, well, the background that led to the implementation of this program. It addresses not only the non-communicable diseases risk prevention, but also health promotion. We are talking about the research B-School, with the acronym B-School, that actually is a health promotion intervention that addresses vulnerable schools. And concerning this research, we are addressing some preliminary results, mainly those that were associated with the co-development process. So we know that non-communicable diseases were integrated in the Sustainable Development Goals in order to reduce the mortality on 1/3 until 2030. We also know that non-communicable diseases share some modifiable risk behaviors, or eventually some modifiable determinants, like unhealthy diet, unhealthy 24-hour movement behavior, such as sleep, sedentary behavior, and physical activity, And all of this leads to other risks, namely obesity and raised blood pressure. We know that in adults, NCDs are highly prevalent, and in children, although we do not see very often NCDs, actually we know that the risks associated and which accelerates NCDs starts during childhood. And we are talking about, of course, some risk behaviors like unhealthy dietary intake, but also obesity and raised blood pressure. In addition to that, we know that the school closures emphasized and accelerated some vulnerabilities that children already had previously to the school closures. And we also know that these inequalities were actually particularly emphasized throughout this period. We know that the rapid overflow of information combined with information voids can lead to confusing messages and altogether create this kind of infodemic that is making hard for people to find trusted information, to know exactly the actions that they should take in order to protect their health and the health of their communities. We know that this confusion leads to risk-taking behaviors and is eroding social cohesion, is eroding trust. That's why recently the WHO emphasized the misinformation and the non-communicable disease-related misinformation as an important issue to be tackled, because we know that more people obtain their health information from digital venues. And of course, while increasing access to information on health issues can be positive, the spread of inaccurate medical information is of course a problem, and it can lead, as we previously addressed, to harmful lifestyles and or dietary choices. In addition to that, we are living with other issues, namely some alterations concerning this health. And of course, this all leads to a syndemic that to which children are particularly vulnerable. That's why we cannot disconnect the human, animal, and environmental health. And of course, we have to stay true to the promise of a world of health, but also a healthy planet. How we can lead, there is a remaining question, how can we integrate these global issues into the local singularities, often unrepeatable. And it seems that participatory approaches that allows the production of health issues, incorporating different perspectives and experiences from key actors might be interesting. In addition to that, it is known that this co-creation process in health promotion not only empowers the subjects, but also contributes to the research process and to the outcomes. Recently, we also emphasized this in a perspective manuscript that Margarita led, and actually we emphasized how the bottom-up equity and democratic approach might be useful during these problems and this COVID-19 crisis. That's the main rationale associated with this intervention program, this Be Empowered in School program. And we aimed mostly to analyze the effectiveness of the intervention program Be School, specifically on children's health literacy and infodemic resilience, lifestyles, overweight and obesity, and blood pressure. And from the beginning of this year, from January to March, we addressed all ethical procedures. Since March, we developed the social listening that has not only online listening, but also offline social listening. In June, we developed the feasibility study, and since September until now, we are collecting the baseline assessment. I would like to emphasize that we are addressing schools that are from territories of priority intervention. In Portugal, we have these TAPE schools that are located in economically and socially disadvantaged territories that are marked by poverty and social exclusion. So these 10 schools are actually from these territories. We evaluated 720 children from 10 schools, and we collected dietary intake with 24-hour dietary recalls. We are also addressing physical activity, sedentary behavior, and sleep using Actigraph GT3 on the wrist of the children. We are also assessing blood pressure, and we are using several questionnaires concerning sociodemographics, health literacy of children and parents, and infodemic resilience. All the children were measured concerning their weight, height, and waist circumference. After the baseline assessment, we randomized schools to control group and intervention group. The intervention group is having the implementation of the intervention program, and the control group is having the standard education and care process. In April 2023, we will start the follow-up assessment using the same measures that were addressed throughout the baseline assessment. Concerning the intervention program, we followed the knowledge integration process, the translational research, and as I told you previously, this included this online and offline social listening, and we have partners from the artificial intelligence, from informatics, that are having this dissemination of information on Twitter, Facebook, and Instagram. And besides that, the offline social listening included focus group assessment and the methodology associated with that. And actually, I'm going to emphasize that in the next slides. Of course, we integrated the knowledge from multiple disciplines, and we have gathered the final program. So the focus group with children was done within 2 sessions in March and April 2022. This was done by 3 researchers that facilitated the process, and 13 children, 7 girls and 6 boys between 7 and 12 years old, participated in this focus group. Of course, all the parents filled informed consent. The session was taped, and besides that, the session was facilitated by the children's draw throughout this process of telling, writing, and drawing. All the session was transcribed, and we performed the analysis of content following Barden following the Barden from 2016 proposals. So, concerning healthy lifestyles, there are several determinants that were addressed by children. They actually know what is a determinant of lifestyles, but it seems that they do not integrate this knowledge into daily life. And for example, they say they have a healthy eating because they eat vegetables and fruit, they drink water, it is important to hydrate, but they say that the food in canteen is good when there is a burger, and concerning the desserts, it is even better to have gelatin or ice cream instead of this fruit. Concerning the movement, they say they ride a bicycle, they play, they do physical exercise, they have some family activities. They go to bed early, some of them. They say that actually sleeping is good for health and they have to sleep at least 8 hours. However, they say that it's difficult to manage all the time they have to sleep. Sometimes they go to bed late and they wake up very early in the morning. And they go to bed to see some Ladybug and other films on the table, on the tablet, and sometimes they go and watch TV. And therefore, when they get to school, they feel very sleepy. So actually, we have to emphasize this lifestyles determinants throughout this intervention program. That's why we developed a narrative of a bee that pollinates with health knowledge and builds its honeycombs throughout the process of implementation of the intervention program. We are focused on 2 lenses, not only teachers' education and training, but also their intervention in classrooms during their daily life with children. We also have challenges to families 2 times a month that are going to be illustrated by children, these challenges. So these are the honeycombs, and this is the forest. And of course, we have different determinants that are going to be addressed. You can see here the one concerning the sleep time, the other concerning healthy lifestyles, but we are also having other issues, namely the screen time. We have this website, the B-School, it's in here, .as.umino.pt, and actually this has been interesting to have more information directed to parents and teachers, and they can find everything about us on that. And hopefully we are going to, at least throughout this period, update several times the website. Besides that, we developed some animations for children because as long as we find some issues, we try to get or to address those issues rapidly and in a way that children feel themselves motivated. These are the team of the B School, we have several meetings. We go to schools and we have teachers on our side, and actually this is being a very enthusiastic and very interesting implementation process. And thank you for your attention. If you have any questions, I don't know, Kevin and Margarita.
Thank you so much for your very interesting presentation. I think, Margarita, we have room for 1 or 2 questions, right? Yes. So I asked you if you have any questions, and we got one question from Per Anthony Boras. He asked, did the protocol consider measuring sleep pattern and screen time?
Yes. Actually, is this a question, Kevin? May I say something?
Yeah,
yes.
This is a question, yeah.
Yes, actually, we are measuring that with actigraphs, with accelerometers used on the wrist of the children, and they use these accelerometers 24/7. This gives us information about physical activity, sedentary behavior, and sleep. I believe that Carmel has also a question. And yes, Carmel, we have 6 schools in the control group and 4 schools in the intervention. And the amount of children in each school is different. That's why we had to do this randomization process. And we have equivalent number of children according with this randomization process. Thank you, Carmel.
Thank you, Carmel. Another question that I have, I was really thrilled to see that you used social listening as a strategy. And I think I'm really delighted to see that, because I'm very interested in that, because I also see it as very promising. Could you tell us a little bit more about that, how we did
Yes.
that? What kind of methodology did you use? How many participants or how many social media?
Okay,
Yeah,
Kevin, concerning
to your screen, yeah.
Yes, concerning that, as I told you, we have partners from the field of informatics, fellow that is leading the process, and actually they started with Twitter, because they said that the API strategy was better, and they followed with some keywords, and actually they received 1 million of tweets and right now they are cleaning all these tweets, so they go to the websites and see what's the information they have there. So hopefully in about 1 month, probably we will be able to give you more information concerning that. But right now I can tell you that we are using Twitter at the beginning, and then we will use Facebook and also Instagram. Okay. And actually this is quite an interesting topic, because of course we have this kind of issues already in process. And actually 1 month ago, WHO addressed how important this issue is concerning tackling NCDs. And actually we are very enthusiastic to see that we are, well, at least giving more information concerning this important issue.
Thank you so much. This is such an important strategy. I shared just a link with you to the EARS platform that has been built up by WHO, just to give you some information about what social listening is for all others who have not been involved in social listening strategies. So thank you for this. Do we have still room for 2 more questions?
Yes,
Perfect.
yes, we do, please.
Okay, super. We have one question from Mehmet, who is asking what type of difficulties you have faced when you persuade the necessity of this project to teachers and parents. So it's more an implementation question.
Yes, actually, Mehmet, the first thing that came to my mind was time. So it's very difficult to manage time of families. It's very difficult to manage time of teachers. So how we overcome this time issue? Well, trying to be very, how to say, trying to involve them and trying to be on using their time accordingly with their needs. So if they want the training process at the end of the day, we go at the end of the day. If they want in the middle of the day, we go there in the middle of the day. So we try actually to be very tailored to the singularities and to the local needs. And I believe that Antonella also addressed this involvement of parents. So we have teachers as the mediators. The trained teachers will integrate the knowledge in the classrooms, and besides that will be important in having this discussion with the parents. So they have WhatsApp groups, they have a mailing list, and they will use this kind of communication, these sources of communication, trying to address all the B program. And besides that, we have these challenges 2 times a month that we are having a direct contact with parents. For example, the first challenge was about having a healthier Christmas. So people will have, families was challenged to increase physical activity and to give us some recipes, healthy recipes about this Christmas time, for example. But we are addressing others, and I will be very happy to show you more.
Thank you so much, Rafaela. This is very, very interesting. I think there are so many more questions, but to give the chance for our next speaker, I would suggest that we stop here with the first presentation, and then we hand over to the second one. So I would hand over to Margarita.
Thank you, Rafaela, very much. We can come back to these issues after Outi has presented, so we can discuss again together. But now I have a pleasure to introduce Outi Savolainen. Outi, you are a postdoc researcher and university lecturer at the University of Eastern Finland, Department of Nursing Science. Your research focuses on the mental health promotion of children, and you successfully defended your thesis last June. You have worked in EU-funded research and development projects dedicated to children's health promotion, and as said, you are a member of Schools for Health in Europe research group. The title of all this presentation is Promotion of Children's Mental Health, Key Findings from the School Context. So we are very happy to have you here, Outi, and are very excited to hear your presentation. Please, floor is yours.
Hello, everyone, and thank you, Margarita, for a nice introduction. It's my pleasure to be here. Thank you for the invitation. I'm glad that I have this opportunity to present the results of my study here. So, as Margarita told you, I'm a postdoctoral researcher, and I defended my thesis last June. And the study was about promotion of children's mental health, and specifically, I was interested about how it is considered in the Finnish municipalities. And today, I'm going to tell you some key findings of my study from the school context. You might know that there are many risk factors and also promotive factors which affect children's mental health and well-being in general, and this can be related to children, family, or some larger context. And children with a lot of these risk factors, they belong to a vulnerable group, and we need to pay particular attention to their well-being. They are in a greater risk, for example, for later mental health problems, and that's why it's important to identify these risk factors, and we need information how to promote their mental health at school, and we need also information how this mental health promotion is implemented in practice at the moment. So in this study, which I'm going to tell you about, the focus was not on mental illnesses or symptoms. The perspective was on mental well-being. However, I want to give you some number here as a background. The prevalence of mental disorders in children aged 1 to 18 years is between 13 and 20% worldwide. And in the European region, anxiety and depression are among the 5 most common diseases. Among 10 to 19-year-olds, more than 4,000 deaths per year, and that's about 15% of all deaths are due to suicide. It should, however, noted that the research data has focused on mental health disorders prevalence in older children and adolescents, and the prevalence in young children are limited. Some statistical information from Finland: approximately 1.2% of children aged from 0 to 17 receive compensation for depression medicines annually. And in the North-Savo region, where the study was conducted, the corresponding number in 2018 was 2.1%. In 2021, out of 1,000 children and young people aged 0 to 17, 4.8 of them received hospital treatment for mental disorders. And again, in the North-Savo region, the corresponding number was 7.3. So morbidity is the highest in the region of North-Savo, both in terms of mental health and other disease compared to whole country. During the last years, the use of children psychiatric specialist healthcare has increased. However, mental disorders in children and adolescents have not been found to have increased significantly. And one explanation for this might be that adults' ability to identify problems has improved, and that's why the use of psychiatric healthcare has also increased. In addition to corona pandemic, there are other well-known factors affecting children's mental health in Finland and in the Europe at the moment, as we all know. The ones who suffer the most are those who have a challenging life situation anyway. Problems accumulate and they are intergenerational and so on. But luckily, most of children and young people are doing well, but we have to pay special attention to those who are doing worse. Mental health promotion aims to influence the determinants of mental health, not only by creating supportive environments and living conditions, but also by reducing risk factors, which are harmful in terms of mental health. And both of these factors, promotive factors and risk factors, they can act at different levels. Like here, levels can be divided to individual, interpersonal, organizational, community, public policy. And previous research has focused primarily on risk factors and more specifically accumulations of risks, which are more strongly related to children's mental health than some risk factor considered individually. Then factors that support children's mental health, they have been studied extensively from considering what the different protective factors are, not so much as an individual promotional factors. The previous division was based on this socio-ecological model of health promotion, and it was the theoretical background of my study also. In other words, the promotion of children's mental health, it was examined at 5 different levels of socio-ecological environment. And I will tell you later about the results at the organizational level and more specifically in the school environment. Based on previous studies at school, pupils' good interactions and emotional skills, friendships, relationships with cool adults, homeschool collaboration, and the school's relationship with the rest of society, these are important. Supporting children's friendships and preventing bullying can also significantly enhance children's well-being and mental health. High-quality professional training, it is central to developing teacher understanding and competence related to their pupils' mental health promotion. Better teacher well-being is linked to better pupil well-being and less psychological difficulties. And school safety and school engagement improve pupils' positive development and protects against mental health problems. Many of these risk factors for children's mental health in the school context are related to the pupil, such as school failure, poor attachment to school, and poor communication skills. Of the risk factors associated with peers, bullying has long-term effects, as does peer rejection and deviant peer groups. Next, I will move on to my study, and I will tell you just shortly about the methodological issues, and after that I will raise some key findings from the school context. So these were the sub-studies, and first we investigate views related to the promotion of children's mental health, how it is implemented in practice, and we used survey. Participants were early childhood education care, basic education, and primary healthcare professionals. Second, we examined how children's mental health is considered in the plans and decision-making of municipalities, and we used document analysis for that. And after that, the views of public health nurses, as well as municipal policymakers and leading office holders on the factors affecting children's mental health were explored. And the results are published in the articles shown below. I picked some key findings related to the school context, and these findings are from survey, where professionals assessed current children's mental health promotion practices. Fewer than half of the basic education professionals reported that intervention for children's mental health symptoms occurred at the sufficiently early stage in their municipality. So what we already know about the importance of early intervention, this is a rather worrying result. In addition, the data were collected before the corona pandemic, so probably the situation has not improved. 29% of basic education professionals agreed that children's mental health services work well in their municipality. There has been many problems in the mental health services for children and adolescents, for example, in the North region, and the QE situation has long been a concern, so this is not a surprising result at all. 9% reported that workers who work with children with psychiatric symptoms have arranged enough occupational counseling in their municipality. Especially teachers felt that the children's symptoms have increased and become more difficult, and that they do not have enough skills or tools to deal with it, and they would like more occupational counseling, of course, but there is not enough of it available. And as I told you earlier, the well-being of teacher is connected to well-being of pupils, so occupational counseling should definitely be increased. These findings are from survey as well. Teacher assessed the multi-professional collaboration related to children's mental health issues as functioning well, for example, between school and parents and school healthcare. But they were not satisfied with the collaboration with psychiatry. For instance, they needed more information about the children's situation. After the survey, we had some idea of how the promotion of children's mental health is realized from the point of view of those who work with children. And we wanted to find out what municipalities actually are doing to promote children's mental health and how it is taken into account in the municipalities' plans and decision making. And the method was document analysis, which I will not describe in detail now, but just in short, we used planning documents related to children's well-being and minutes of municipal councils, boards and committees. They were from 3 municipalities and for a 1-year period. And we analyzed the documents, and the total number of documents was 269. And the analysis frame included these eight domains of structural indicators of mental health and totally 53 recommendations to improve the conditions for mental health. And you can see the domains here in the radial diagram. Domains were National Mental Health Framework, preschool experiences and family support, childcare, promotion of mental health through schools and education, employment and workplace mental health, social capital, mental healthy communities, physical environment, leisure activities, and mental health and older adults. Total of 1,169 mentions were found related to these 8 domains. The societal and environmental domain, social capital, mental healthy communities had the highest number of mentions, and the promotion of mental health through schools and education had the lowest number of mentions. And this figure 1 shows how the mentions are distributed by municipalities. There are some variations, but I think quite similar figures. The domain promotion of mental health through schools and education included these 6 indicators, and the green ones are those that were quite well taken into account in the planning documents, and the red ones not so much. But in the minutes, there were just few mentions related to this whole domain and these indicators. These are taken from the results of the interviews, how to promote children's mental health at school from the public health nurses, policymakers, and office holders' point of view. Public health nurses mentioned some basic issues such as ensuring small group sizes and the necessary staff. Collective school welfare groups formed the largest set of activities in the entire school community, and nurses saw the importance of involving pupils in the group. Then taking care of friendship issues and tackling bullying was also highlighted in the school environment. Lessons and theme days on emotional and interaction skills, mental health and normal development were one of the classroom-based activities. Policymakers and office holders' perceptions were quite similar than public health nurses' perceptions. Maybe their perception was a bit broader, not as detailed as that of the nurses. For example, they described the importance of multi-professional collaboration in general. Nurses, in turn, talked about collective school welfare groups, which is, of course, collaboration as well. Policymakers and office holders also raised the importance of teacher training and supervision, and I think this was interesting because issues related to supporting teachers were barely visible in the municipalities' planning documents and decision making. Then some conclusions. Children's mental health promotion in the school context include both classroom-based and school-wide activities, promotion of inclusion and equity, prevention of exclusion. These are starting point. The prevention of bullying, we cannot overemphasize this, and children's friendships must be strengthened. Collaboration is other big issue. We need functional collaboration structures, sufficient resources, for example, personnel and time. and positive attitudes towards collaboration. I think the importance of the multi-professional collaboration is recognized, and there is willing to collaborate, but structures do not always allow comprehensive collaboration. Development needs in the promotion of children's mental health in school context based on this study include adequacy of occupational counseling for teachers, which should be secured. And by this, we can partly improve also the early intervention of childhood mental health symptoms. These rest are not related just to school context. They are related services for children and families in general, but I want to put them here. The quality of services could be improved by unifying family services and resourcing services of children, and finally, emphasis of promotive services and supporting well-being in ordinary everyday life of children should receive more attention. Thank you very much.
Thank you so much, Outi, for your very nice presentation. I think we don't have any questions or comments so far. Please write those in the chat so I can ask. I do have some comments myself, but Hannele is asking here, thank you, Outi, for your presentation. Based on the findings, what is the most important step to go further in line with the children's mental health promotion? That's a big question, I think.
Yes, it is. I think if I think this large issue as a whole, one of the most important issues is, as I said, to promote children's well-being in their ordinary everyday life, and take it into account in every decision making in municipalities, political decision making, and so on. And how to do that, I'm not sure, but there are of course some recommendations how we can improve this consideration. But I think that's just one of the starting points.
Okay, thank you, Outi. And more questions have been written here. Kevin asks and comments that the structural indicators mentioned by communities in the minutes is very interesting, and it's in slide 13. How do you use these findings to support communities?
I cannot see the question, which would help if I can see it, but
yeah, about the structural indicators. And how do you use these findings to support communities? Can you open the chat or not?
I think I should stop sharing so then I can see better.
Yes.
Just wait a minute. Now I can see the chat. Yes. Yes, okay, thank you, Kevin, for your question. I think I can use these findings to inform municipalities so that they know. I think they don't probably, of course, they all want all the best for the children, of course, and that's not the problem. But I think that they don't just know that how they are using their attention or how they so just to inform municipalities and that came to my mind first.
Okay, thank you. Then Carmel asks, thank you for the presentation. Did you consider peer counseling or peer referral or possible cases in addition to existing services at the municipalities? And you can, of course, Carmel, you can explain if Outi needs some more explanation yourselves. If it's...
It would be nice, Carmel.
Just I'm aware of certain studies where they use so people of the same age group, and these individuals would be responsible to identify possible cases of mental health issues and then guide them to the services that are available. So I was wondering if you had this included or you thought of it in the project that you mentioned.
If I understood you right, I think I didn't use this procedure which you mentioned.
Thank you.
Okay. And then Venka, do you have any experience in the involvement of the school-based psychological services in the promotion of mental health? And continues, in Denmark, they are only involved in diagnostics and eventually prevention, and it's difficult to shift focus to promotion.
Yes. In general, psychological services in the school in Finland, there are some problems. There are not enough school psychologists at the moment. So I think that's one of the big problems what comes to school psychological services in Finland at the moment. And of course, because they have a lot of pupils per one school psychologist, they have to use their time carefully, and I think it might be so that the time goes to for example preventive services, not so much as promotive services. And I think that's the situation in the school healthcare in general.
Thank you, Outi. And the last question is, are aspects related to intersector reality important for the research? If yes, how are they considered? And thanks for the presentation from Roberto.
Yes, of course. Thank you for the question, Roberto. Intersectorality, it is very important as multi-professionality, and if you mean how we consider it intersectorality in the research, so we used a multi-professional perspective in the research, and it was one of the most important issues in this research as well.
Okay, thank you very much, Outi, for your answers, and for all presenters and the audience. I think we will close this session now. Because of the time, we have reserved 1 hour for this, but I warmly thank you for your participation. And then I also gave one task more for the presenters, and it is what is the final take-home message to us all about this theme? So please share your messages. Would you like to start, Outi?
Okay, am I mute? I'm not.
Right.
Okay, my take-home message is that in addition to school context, children's mental health is affected by various factors at different levels, as I mentioned, and that's why children's mental health promotion should be taken into account at every of these levels, from the individual level to political decision making also. And in the school context, children's mental health promotion, it includes both universal actions and targeted actions, as we know. And I think targeted actions are needed if a child has some individual needs, and considering these individual needs, we can promote the equality for every child in these universal services.
Thank you, Outi. And Rafaela?
Thank you, Margarita. I would add that the participatory approach, this co-creation process, seems to be very important and a very interesting strategy in designing intervention programs. So I would leave that.
Thank you. Thank you so much, Rafaela. Kevin, would you like to say something more, or are we just wishing everyone Merry Christmas already and Happy Holidays?
I think that it is that's quite correct. Yeah, thank you all, everyone, for attending this third webinar. It's a little routine for the SHE Research Group that we have now built on, that we have had our third one. So I hope you will join the next one in 2023. So good that we had so many of you today. I think we are progressing quite well with our webinar series. So wishing you a wonderful Christmas time, and hope you will have the chance to rest and enjoy the days, the winter days, and hope to see you next year again.
Yes, thank you so much. Bye-bye, everyone.